Dr. Piskin, lately there's a lots of news about people falling asleep in the afternoon on the street and anywhere for that much. In fact, in your neck of the woods, wasn't too long time ago that a bus driver wrapped a bus around a ball, killed people, and they suspect that he had sleep apnea, meaning he snores. Most people who snore have sleep apnea, not all, but doesn't get enough oxygen, stops breathing during the night, and then those people have a tendency of literally passing out throughout the day. More dangerous than a drunk driver and kill more people, maybe because a drunk driver, at least in the last second, he tries to steer the car where it's maybe supposed to go. But a sleep apnea guy, he just flat passes out. Can you tell us a little bit about it, and what the heck does a dentist have to do with helping with sleep apnea, with being more energetic next day?
Wow, that's some question.
Ha!
But I'm sure I can help you with some of that. Okay, yeah, you're right. That was a terrible accident that we had near us, and they feel that there is something to do with his sleep apnea, the driver of the bus. But how can dentists help, and what is actually sleep apnea doing? Well, if you're sleeping at night and you are not able to get into a deep sleep, which is called REM sleep, and you constantly are waking up or waking yourself up because you're not getting the carbon, not enough oxygen. So your carbon dioxide that you're breathing you have a sensor in your brain that says, hey, we got too much of this, not enough oxygen, wake up. So you never get enough sleep. And you become very tired most of the day because you never got a deep, good night's sleep. And everything gets affected. You're exhausted. Some people get depressed. They don't realize it's because they haven't been sleeping well. They're not enjoying their life. They get cranky. They're not pleasant to other people. And, of course, there's dangers like driving and extreme situations where they fall asleep, where they shouldn't be falling asleep, at times when they should be alert. It could be working with machinery, driving, and not paying attention. So all that's going on. The question is, how do dentists help? There are sleep centers that can diagnose and help determine whether they do have a sleep apnea situation. But in dentistry, we have certain types of appliances that can help position the jaw a little bit more out so that when they breathe, their tongue is not obstructing the back of their throat, and they can get more oxygen in when they breathe. So someone that has large tonsils, a large tongue, and they're laying back and it kind of collapses back there, this appliance that we as dentists can help patients with helps take their jaw and move it a little bit out, and they can wear it at night. It's very comfortable, and that will help them breathe the proper amount of oxygen in. And sometimes that's all that's needed. There's patients that say, well, I tried that CPAP machine, which is a machine that they have to have. It goes over their face. It's like a big oxygen mask, and it forces oxygen while they're sleeping. Most of them just hate it. They're miserable. It dries out their mouth. And so there are other choices that possibly people can consider, and they can see their dentist and as to consider maybe having a dental appliance help them with that type of problem, which is sleep apnea.
So, because, for instance, I remember, 3-4 years ago, I knew this person who is a sports teacher or a gymnast, kind of like whatever. And I asked him, what's the best exercise a person can do? And I expected him to say something like swimming or whatever, right? Is the thing which we always hear or rank number one. And he just looked at me and he says, Helmut, the best exercise you can do will be the one you actually will do. And I mean, gee, so much logic in one day, in one sentence. Because, like just about probably every other person in this country has a couple, 2, 3 little exercise machines at home. I don't even need one because as a young person I was, sporty and, did judo and karate. So I know how to move the body without any machines. The truth is, I don't do it without machine and I don't do it with machine. Now, I go skiing in winter because that I enjoy. So there I get my exercise, except, my wife keeps telling me it's not enough, and her the doctor seems to be agreeing with it. The point is, the appliance a dentist makes seems to be something which a person can tolerate, can sleep with, where the mask seems to be something which apparently 80% of people literally take off, and after a few days or weeks of trying and suffering, basically they sleep less with the machine because they can't sleep. They toss and turn. It's a bulky thing. You have to sleep on your back to make it go right. It's just so, even though it might be the best thing, it obviously isn't doing any good if you don't use it. That's basically what it is, right?
You're right. It's what you are going to feel comfortable doing. Even if it's not as good as the next thing, it sure is a lot better than doing nothing.
Yeah, absolutely. And because with sleep apnea, if you use or don't use such a machine, it's a little bit like with eyeglasses. You know, if you don't see and you put eyeglasses on it, you see. You take them off, you don't see. Done. It's not like with good food or supplements, vitamins, exercise, where you can do it, and if you miss a day or two here and there, well, that's not a big deal. The day you don't use it, the day you will be interrupted in your sleep, the day you'll not get oxygen, probably you won't die. There's not too many people on record of dying from it, but again, they haven't checked into it. It's only lately they start checking into it. Anyway, you're going to wake up exhausted next day, period, because you didn't sleep that night, and you don't even know it.
That's right.
Okay? Would you say that most people who snore have sleep apnea, or, I mean, just from your feeling or from knowing, I don't know?
I'm not really sure as far as the percentages that have been to medical centers, and they hook you up to all the gadgets, and they can test the amount of oxygen that you breathe in. But there are people that have large uvulas, the thing that hangs down in the back on your soft palate. Sometimes that just flaps back and forth when you're breathing. Some people have a deviated septum, so they can't breathe well through their nose. They breathe more through their mouth. And that flaps back and forth, the uvula. So that doesn't mean they have sleep apnea. They might be getting plenty of oxygen. They might be alert all the time. But there could be other reasons. Some patients have a small lower jaw, and the tongue is sitting farther back. So they have trouble getting the air in because maybe their adenoids are all clogged in their nose, and they need to see someone like an ENT to help with that, the tonsils or the adenoids that are in there. I see a lot of children, and they have large tonsils in their back, in their mouth, and you look in there and you go, where does the food even have a chance to get down that throat? But that's only what you can see, but there's a lot going on in the back that you can't see, and if they have a lot of tonsillar tissue that's inflamed, they might not be able to breathe well, and they could be snoring, mouth breathing, sound very nasal, and all those things can cause breathing problems. The question is, do they have sleep apnea? I'm not sure what % of those that I've just spoken about might have that.
Sure. Well, anyway, so people can go to they can ask their physician, they can go to a sleep apnea lab. Most of the sleep apnea labs will suggest a CPAP machine, and again, it's a good thing, except people should be aware of that most likely they won't be able to wear it, and it's just because that seems to be a statistic that people just not willing to wear it. So that they should definitely check with a dentist. Also, some people say, well, there's no real complete need to go to a sleep test thing, because if you snore, if you wake up tired, exhausted, if in the afternoon you feel like, Jesus, I need a coffee, I need a Red Bull, and you snore, and maybe you have a muscle reaction that your leg goes jerk or whatever, well, your chances are very high. Go and get the sleep apnea appliance, which is rather cheap. It's like a mouth guard, and you'll be fine afterwards. The only difference is when you do a test, you see the difference before and after. Those tests are usually not all that cheap. However, as I said, not necessarily needed to make the treatment, and knowing that you have it is really how you feel. And if you realize that you're not feeling quite as energetic with all the other things you do, you think you sleep well, you think you do this, you think you do that, but yet you're still exhausted. No, you're not necessarily getting old. You might have sleep apnea. Might.
And there's also just the patient that might have a little bit of snoring problem, not sleep apnea related. So we have these anti-snore devices in dentistry. And, of course, the person that's most ecstatic about it is the significant other.
Yes.
Because the one who's snoring is asleep anyway. They have no idea what's going on. It's the spouse, of course, or the significant other that says, thank you. I can get a good night's sleep. And so many times non-invasive treatment, simple things like these types of devices in dentistry are something that patients should think about and ask their dentist about. So it's a great idea.
Yeah, correct. Then another dentist told me even that because of sleep apnea and like not sleeping quite as heavy as you should, waking up to the saying, those people also have the added thing of needing to go to the bathroom throughout the night more often. So they think they have a bladder problem, which they might a little bit. But if they would actually sleep normal fine, that little bit of bladder pressure wouldn't do anything to them and they would just sleep through. But because they don't, they keep waking up. Does that make any sense at all?
I never thought of it that way, but that's probably true. If you keep waking up, you keep thinking, well, maybe I got to go to the bathroom. That's why my body's waking me up, which a lot of times that's what it is. But in many cases, you're right. It might be just because you're not sleeping and the body's waking you up saying you're not getting enough oxygen in you. So here I am awake. Well, what do? I better go to the bathroom. Well,
right.
Maybe it's not that at all.
Yeah, or at least, I mean, it wouldn't be big enough of a pressure to warrant to go, but because you're already awake, you feel the pressure, you go, okay, I guess that's what it is, let's go. So the point is, people who think they sleep 6, 7, 8, 9 hours might only sleep a couple and never realize it. Dr. Piskin, thanks for shedding light on it.
That's right.